Welcome from my side to effective strategies to counter science denialism in public. Well, the problem with debates, whether they happen on social media, on television debates like TV talk shows, or on radio, is that they are highly attractive. They were once called human drama at its rawest. And if we think about debates on social media, we all know what that means. They are persuasive in that they can change risk perceptions of individuals, attitudes, and intentions to behave in a scientific way, and they're naturally combative. The problem is that science deniers, whether they are COVID-19 deniers or vaccine deniers or climate change deniers, they are also highly present in media. That is, they use debates as a format for their messages. They are also persuasive in that they can change risk perception, attitudes, and intentions, and they are highly combative too. They just love to talk and combat with science advocates about any scientific topic. So what can we do about that? One potential solution to that is described in the How to Respond to Vocal Vaccine Deniers in Public guideline by WHO. The solution in there is called the rebuttal approach. So how does the rebuttal approach works? Potentially there is an infinite number of messages that a science denier, like a COVID-19 denier or a vaccine denier, can come up with and share on social media or on any other platform. So it's very difficult to prepare for such a debate. But it's not that difficult if we use the rebuttal matrix, because then it is not an infinite number, but rather a limited number of messages. Why? Because science deniers, in this case vaccine deniers, always address the same 5 topics when they spread messages. They either talk about the threat of the disease and play that down. They talk about the safety of vaccination, about alternatives to vaccination, about trust in health institutes, and about the effectiveness of vaccination. So rather than preparing for an infinite number, we can prepare for 5 topics and have 5 key messages prepared for any debate. But there is another string that we can use, and that is called technique rebuttal. That one is the generic way of responding to science denialism, because these techniques are shared across domains. COVID-19 deniers, vaccine deniers, climate change deniers, yeah, even Holocaust deniers use these rhetorical techniques to make their arguments sound appealing. These techniques are selectivity. They just cherry pick data, basically. It is impossible expectation. They expect something absolutely impossible from science. They use conspiracy theories in that they think there's always something hiding behind the curtain. They use false logic and misrepresentation, like ad hominem arguments, and they use fake experts, people who appear to have a doctor but never actually achieved one, for example. So how can we apply technique rebuttal and topic rebuttal to messages of denialism? Let's have a look at an example. Vaccines should be 100% safe is one of these examples. And actually that statement addresses safety, so we can pick our key message to the topic safety and use it as a response message. And that example also addresses impossible expectation, because no medical product can ever be 100% safe. So we can pick our key message to impossible expectation and respond to that misinformation. In a more realistic example, it would look something like that. The text is longer from the denier called Mr. Miller here, but you don't have to read all of that, because if you scan it with the rebuttal perspective, you see that the vaccine is not 100% safe. The rhetorical technique of impossible expectation is the way Mr. Miller tries to make his argument sound appealing. So we can respond to that by uncovering these rhetorical techniques in public, saying something like, Mr. Miller demands 100% safety from the vaccine against dysentery. In science, this argument is called impossible expectation. It is an impossible expectation because science can never guarantee 100% safety for any medical product. But he's also addressing a specific topic, and we can use topic rebuttal in the following way. The scientific evidence is clear. The vaccine against dysentery is a safe way to avoid the disease. The risk of dysentery by far exceeds the risk of vaccination, and so on. We can also combine these 2 strategies and have a very elaborate way of responding to denialism. As a scientist, it is always interesting to find whether that actually works. Do we have empirical evidence? And yes, we do. In our article called Effective Strategies for Rebutting Science Denialism Public Discussions, we looked at a few hypotheses. First, do science deniers actually damage intentions and attitudes of the audience? So are these messages of deniers actually persuasive? Can we mitigate the damage by using topic rebuttal or technique rebuttal as presented to you in the previous slide? And can we even increase the mitigating effect by combining these two strategies? So here are the results. We conducted actually 6 experiments, and in the article that I presented to you, we did an internal meta-analysis to look whether these strategies are actually effective across all experiments. What I'm presenting to you now is a bar chart from one experiment only, but the pattern is the same across experiments and the results are also identical. What we did is people were sent to different conditions. Either they only received the denier statement and there was no rebuttal at all. That is the left bar called no rebuttal. The next one is topic rebuttal. So people received to the denier argument the topic statement that actually vaccines are safe and that the risk of the vaccine is not so high as the risk of the disease and so on. In the next condition, people received only the technique rebuttal about, for example, impossible expectation. And in the fourth condition, people received the combination of both. What we measured was the change in intention. So the individuals actually indicated their intention to get vaccinated before they received the material and afterwards. So we could measure the change. What we find is vaccine deniers and science deniers in general damage attitudes and intentions. So it is not a good idea to give them a platform, because even if we rebuttal those messages, there is a negative trend. But when the misinformation is out there, we can actually mitigate that damage by using technique or topic rebuttal. The third result is there is no evidence that a complex message that combines technique and topic rebuttal is more effective than the single strategies. What does that mean? Responses to deniers, COVID-19 deniers or vaccine deniers, don't have to be complex. They're just as effective if we use simple strategies like topic rebuttal or technique rebuttal. And if you know a lot about COVID-19, go out there and respond to the misinformation with the knowledge that you have. If you are a communication expert, go out there, use technique rebuttal and identify and expel the rhetorical techniques that COVID-19 deniers use, and you will be effective. The fourth result is that, and you can't see that in the bars, but we did some supplementary analysis, there is no evidence of backfire. What does that mean? Well, there are individual groups that are more prone to misinformation. For example, people who generally vote for Republican parties, or people who have lower vaccine attitudes before they entered our experiment. And what we saw is this pattern, the effectiveness of rebuttal, was even there when people were vulnerable to misinformation. So it is effective across these groups. To conclude, messages of science denialism do cause damage. Rebuttal approaches mitigate the damage, and rebuttal is even effective in vulnerable groups. What does that mean for COVID-19? Well, let's just have a last example. Let's look at this exemplified statement: social distancing is not 100% effective. You will see, well, he's talking about effectiveness, but this guy is also addressing, again, impossible expectation. And because technique rebuttal is a generic approach that can be applied to any domain, we can actually use technique rebuttal right away and apply it to COVID-19. Mr. Miller demands 100% effectiveness from social distancing. In science, this argument is called impossible expectation. It is an impossible expectation because science can never guarantee 100% effectiveness for any intervention or prevention measure, and so on. So within the approach to respond to vaccine deniers and climate change deniers, there also lies a key to how to communicate to COVID-19 deniers or fake news on COVID-19. And these are the resources I used for this presentation, and I thank you very much for listening to me.